So it turns out that peptides are not just for weight loss. They can actually help with a lot of other midlife ailments or struggles, whatever you want to call them. And today we have Dr. Aleksandra Gajer here to tell us how. So thank you so much for coming on the show. I'm very excited to learn about this from you.
Yeah, thank you so much. I'm excited to have this talk.
This is going to be good. And I want to jump right in with aesthetics because, listen, I feel like anytime you get a group of midlife women together, the conversation is going to turn to our skin, our thinning hair. We're going to start talking about our wrinkles, and then we're going to start talking about the topical products we use and the lasers and the needles that we're subjecting ourselves to. And I recently attended one of your webinars where you mentioned that peptides can actually help with the health and appearance of skin. And I was so surprised. I was on the edge of my seat. So I can't wait for you to tell my listeners about this. So tell us, how do peptides help with this? And which peptides are we talking about here?
Great question. Yeah. So when we're talking about peptides, I think the word peptide can sometimes be misunderstood. There's a lot of skincare that has the word peptide in it. And peptide really just means a short chain of amino acids, like a really short protein. So the word itself doesn't mean much. So many different things can be peptides, but there are some peptides in skincare products, which are awesome. But the peptides we're talking about today are injectable peptides. And these peptides have a specific function in the body where they're chemical messengers, and they will enhance or repair something that's already going on in the body. So just like our hormones decline as we get older, our peptide system declines as well, and our body is less efficient at taking care of multiple systems in the body, including our skin. So peptides work at a deeper level. All the peptides that I use are injectable, and they're injectable right under the skin, but many of them have multiple functions, and there are a number of recovery peptides. So these peptides help people recover from athletic performance faster, build muscle faster, heal from injuries, decrease inflammation. And these can be really powerful for skincare. So, and hair care as well. So we understand the hallmarks of aging now. Science has come a long way, and we understand why we age, why things break down. And those are pretty simple. We get more inflammation in the body, which starts breaking down collagen and elastin. Collagen is all the stuff that keeps your skin firm and holds it up, and elastin helps it snap back into shape. So after you smile, you don't want your skin to stay there. So it snaps back to where it should be. And both of those are really important structures in our face and in our skin, and they break down as we age due to inflammation, due to oxidative stress, and due to mitochondrial dysfunction. So there's a few peptides that address that specifically. The ones that I like the most for skincare are BPC 157 and KPV, also another anti-inflammatory healing peptide. But there's a number of others. People often hear of GHKCU, which is wonderful for stimulating collagen production and hair growth, TB500. So there's a number of them. And usually when I work with people, we're working on more than one thing, and we all want that glowing hair, skin, nails. And these peptides are amazing at doing that, but they often have additional benefits as well.
Yeah, I don't know any midlife women that are complaining about one symptom.
Yeah, exactly.
We all have the scroll.
Yes.
This is so interesting. So are you saying the root cause of our wrinkles or crepey or drooping skin or thinning hair is inflammation
That's one of
and
them.
oxidative
Yes.
stress and
Yes.
mitochondrial dysfunction? And so
Yes.
peptides can help with all of those things. What about other things we hear about that help with inflammation, like omega-3s or a cleaner diet? How do peptides
Yes.
compare to those angles?
Great question. I think those are foundational. I think peptides will not erase what a poor diet might be doing to our skin and our overall internal health. So peptides are a wonderful add-on. And you don't have to be perfect. Very few people are. We live in this world that demands a lot from us, especially as women, and it's hard to be doing all the things. But if about 80% of the time you're eating healthy, you're eating clean, which means that you're getting enough protein. Your skin really needs protein in order to keep that elastin and collagen healthy. We also need the micronutrients from different colored vegetables and fruits and a variety of foods and seeds and nuts and all those things. So if you're doing that 80% of the time, if you're doing some movement, which is really important too for our skin health, that's a wonderful foundation, and peptides are a great add-on. Omega-3 fatty acids are so important. I think they're one of the most valuable supplements that we have available right now, and I think most women over 40 should be taking them because it's hard to get enough of that in your diet. So I think that's also a great foundation. They won't move the needle as much as something like a peptide will because they tend to be a lot more powerful.
You mean omega-3s won't move the needle as much as a
That's right.
peptide will? Okay.
Yeah.
But I'm glad you're making this point about having the foundations in place, because we hear that a bunch when it comes to GLP-1s. It's
Mhm.
actually, it can be considered, I don't want to be alarmist, but dangerous to use them if you're not eating enough protein or not strength
Mhm.
training. So making sure that you have those foundations in place. And you're saying that applies here too, whether you're using peptides for weight loss or peptides for hair and skin health, you have to have the foundations in place.
That's right. And I think that, this is an investment in yourself and your long-term health, and you'll get the most out of it if you are doing the other things for yourself that move you along in the process. So if you really want to get the maximum benefits, doing all of it is the most helpful.
And you said long term. So that just made me think too, like, are we taking these things forever? I mean, this is another common concern with peptides is, okay, I go on it and I see these wonderful results. And then what? What
Right.
happens if I stop using them? So we've heard some of that with GLPs. I'm actually starting to hear like some people can go off and maybe sustain the weight loss. I'm sure you have opinions about that, but sticking to the skin and hair peptides, are those taken forever?
These are meant to be cycled. So no, they are not taken forever. That is a really good question. I think that's what makes these peptides different than the GLP-1s. I work with most people to use the GLP-1s short term and not necessarily stay on them forever. Depends where people are. It really depends on what other health problems people have and what our goals are around the GLP-1s. Sometimes we use the GLP-1s and we're able to get off somebody's blood pressure medicines and diabetes medication and cholesterol meds, and then those are really worth it, if we just traded 3 for 1. But in people who have maybe just a small amount of weight to lose or 20, 30 pounds, we usually have strategies about how to make these useful short term. But unlike the GLP-1s, the peptides that are good for skin and hair health, they're meant to be cycled. So like BPC 157, I think is a prime example. It's one of the more popular peptides. It stands for body protective compound, and it was isolated from our stomachs. And scientists found that we secrete this in order to protect the stomach lining from being digested by the acid that we produce. And then when it travels to other parts of our body, it can find areas of inflammation or injury and heal them. So, and then when it comes to our skin health, there is just a lot of reduction of inflammation, and that breakdown of elastin and collagen really slows down, and we can even see some more collagen and elastin production. So I usually cycle BPC at 2 months, 2 months on, at least 1 month off. And if we're doing this mainly for skin health, it, again, depends on the age. And a younger woman who is really mostly looking for another tool to just sort of keep up with skin health, I would recommend 2 months just once a year. And I think that's fine.
And the
But
results would sustain?
they do. Yeah, we see long-term results in someone who has a lot of inflammation. I work with women who have arthritis and a lot of joint and tissue pains, then we might cycle 2 months on, 1 month off, and do that a few times to actually get the results that we're looking for. And if someone already has a lot of deep lines and they want to revive the skin and do a little bit more work in that direction, then maybe we'll do 2 months twice a year. But we do see the results sustained after we stop these peptides, which is really cool.
Wow. And I was curious, how quickly do you see results?
People usually see results within a week or two. They notice a difference. You can see more of a glow to your skin. But again, everybody's a little different, and it depends how much inflammation we're dealing with. The number one sign of inflammation in our bodies is fatigue. And as women, we know a thing or two about being tired. So that's another great benefit. Not only is your skin revived, a lot of women find that they have more energy when the overall inflammation in their body is reduced.
Oh my God, what I wouldn't give for more energy. Like
I
that
know,
alone
right?
sounds amazing. I do want to just ask very specifically about hair thinning too, because so
hmm
many women deal with this, myself included. I think I've lost like 25% of my hair in the last 2 years. It's crazy. Does this same peptide, BPC 157, help with hair thinning?
It does. It does. And I think hair thinning is very challenging. And there's usually not one reason why hair is thinning. We're sort of in a perfect storm in those perimenopause years where a lot of things are changing, and the interplay of different hormones declining causes some of that hair reduction. So I think it's important for women to check their iron levels, make sure they have enough ferritin stores, that the micronutrients are sufficient. But then there are a number of peptides that can stimulate hair growth, and BPC 157 is one of them. GHKCU is a copper peptide that can also stimulate hair growth. And then we have a number of growth hormone promoting peptides. So growth hormones also important for a number of things. And again, in our hormonal transitions, most people don't talk to us about the fact that our growth hormone declines significantly when we go through perimenopause, mostly because we can't replace it easily. We can't just take growth hormone pills or a patch or whatever, but there are peptides that increase our natural production of growth hormone, and that definitely stimulates hair growth, but is also great for body composition. So it just helps turn more fat into muscle, but also really helps with sleep. All our growth hormone production happens while we're sleeping, and it helps women get deeper sleep. So again, when I work with women and they say, I really want to improve my hair, skin, and nails, we usually talk about, well, what else is going on? And let's choose the one that will hit the highest number of pain points for you.
Right. And so this is interesting because I did want to talk to you about peptide use for other reasons too. And so now I'm going to wonder if there's overlap here. So let's talk about peptides for brain health. This was something else you covered on your webinar that I thought was so interesting. Was so many of us deal with brain fog, which is kind of a foggy term in and of itself, but it can mean we don't feel as sharp mentally. We have some memory lapses or word recall issues. We just don't feel like we can concentrate the same way we used to. And you actually gave the example of a male patient who was a CEO who was complaining, saying, I just don't feel like I'm giving this company everything that I know I could because I just am not fully there mentally. And he was your case study. He went on what you call a peptide stack, which I also want to talk about, and saw improvements right away. So tell us what peptides can help with midlife women dealing with brain fog, and what is a peptide stack?
Yeah, absolutely. And I'm going to just back up a tiny bit too, because I think brain fog is such an important topic. And I'm sure you've covered this on other episodes, but both estrogen and progesterone are really important for brain health. And specifically, the region of the brain that's important for memory, the hippocampus, is extremely estrogen sensitive. And when we lose estrogen support, we actually lose the ability to create some blood vessels in the areas that to bring enough blood to those neurons. And we see a lot of neuroinflammation, which is basically inflammation in the brain. We used to understand most cognitive decline in terms of what's happening with the neurotransmitters, but the more recent research really points to neuroinflammation as a driver for a lot of that brain fog, of that difficulty focusing, that I just walked into this room, why am I here? That I'm in the middle of a sentence and I forgot what I was talking about,
Yeah,
and
and
that's
that's a problem when you're a podcast host.
yes, and it's a problem for many successful women who's worked really hard their whole life to get to this place. And then all of a sudden they're there and mid-sentence, they can't remember what they're talking about. And progesterone is highly anti-inflammatory for the brain as well. And as we lose protection for both those hormones, and even if we're taking hormones, it can be challenging to get that back. So there are two peptides that I really like for brain health. They were developed in Russia for their military and their cosmonaut programs for people working in austere environments for a long time, where they needed to stay calm and focused. So one of them is called Salank, and this reduces neuroinflammation, but also increases our GABA neurotransmitter, which is our calming neurotransmitter. So it's kind of the holy grail of feeling calm and focused, which is what we want, right? I think a lot of the things that we have in conventional medicine can either make you anxious and focused or calm and not focused, right? It's one or
Yeah.
the other. So without that stimulant kind of sensation, the link is great because it's very mild and you feel more calm, you feel at ease, and you feel focused, which is that flow state that all of us are looking for, really. I think it's the place where most creativity comes from. So this is a really nice peptide. This one is used for much shorter periods of time, usually 3 weeks on, 1 week off. But again, depending on where women are at, I will often do it for at least 3 months, do that cycle, 3 week off, 3 weeks on, 1 week off. And then Samax is similar to Salank, but it is more potent in terms of focus. So I've actually had women get off their stimulant medications, their Adderall, and take this and feel like they're focused without that wired feeling, without their side effects that we know come with taking stimulants. It does not feel like a stimulant, and I think if you're looking for that sort of thing, that's not what this is. It's more of that subtle. You just have that flow. You have the focus. You can stay on one task. Your brain works more effectively. And this one works also very potent in terms of reducing neuroinflammation and also increasing acetylcholine, which is really important for memory and cognitive tasks.
So are these two that you would recommend taking together in a stack?
Great question. Yes. So stacks. So I do often pair peptides together, and I find that certain ones work synergistically together. So basically, they make each other work better. And Salank and Samax are two of those peptides. They both work. There's a lot of people who take them apart. When they work together, they can be really powerful at enhancing brain health and helping people have that clean focus. And there's a number of other categories of peptides that also have stacks where they have complementary functions, where if you pair them together, you get more out of them together than you would apart or one after the other.
So does this mean you're giving yourself 2 shots and the cost is doubling? Like, what does logistically this mean?
Yeah, sure. So sometimes, yes. Sometimes you can have multiple peptides in one syringe and you're just giving yourself one shot. They're often very small amounts. The needles are tiny. They're like a hair and they go right under your skin. There's no bleeding. Generally no bruising. Sometimes we can combine multiple peptides into a syringe. There are some peptides that are daily, others that are not. So there's a number that are either once a week or 3 times a week. But the injections are a part of the deal.
Well, we're hearing now that some peptides are available orally or sublingually, like a lozenge. So
Yeah.
what are your thoughts on that delivery method?
Yeah. So the GLP-1s are available orally now. So The problem is that peptides are different than medications. Medications tend to be bigger molecules that will either block a pathway or make it stuck in the on position. And then when it's done doing what it's supposed to do, it has to be broken down by the liver, and it has some metabolites that may or may not be toxic, and they have to be excreted out of your body. Peptides are different because they are literally just small chains of amino acids, like a piece of chicken. And so once
Like a piece of chicken. I love it.
yeah, so they're like the food that we eat that's made of mostly proteins. So when they're done doing what they're supposed to do, they're broken down to their individual amino acids and digested like your food. So because of that, most peptides do not survive the stomach. They're just broken down to the amino acids and they don't do anything else. And in order for them to work, they have to get out of the digestive tract. So it's actually interesting what they did with the GLP-1s, the orals. They included something called a snack complex, which changes the pH of your stomach for 30 minutes. So you have to take it on its own with just a very small amount of water, and your stomach is usually very acidic, and this turns off the acidity so that the peptide can reach the other part of your digestive tract where it can get absorbed into the bloodstream. But it's a pretty intense mechanism that has to happen for a peptide to survive the GI tract. They figured it out with the GLP-1s with that snack complex, but you do have to take it alone. You can't have any food with it. And it's massively changing the physiology of your digestive tract for a short period of time. But the
Wow.
other
And I imagine
peptides,
if you did accidentally or actually eat something in that window, that would be kind of dangerous because you would
yes,
have the wrong pH balance in your stomach to actually start to break it down.
right. You would probably
Hmm.
have some serious indigestion and not feel well. So
Mm-hmm.
so it's a huge task to have these peptides absorbed orally. And because most peptides are not FDA approved and most of them are still what are called investigational compounds. So there's a number of reasons for that. Some of that is because pharmaceutical companies haven't found an indication for them in order to patent them into their drug. There's also some laws about the structure. If the peptide is too short, it can't be patented. And that puts us in a dilemma where we can't do enough studies to actually make it through those phase 2, phase 3 clinical trials to get an FDA approval. So there are a number of reasons, but most peptides are just not going to make it through the GI tract. There are some that act specifically in the stomach and that are for the stomach. Oral BPC is actually really good for stomach lining since that's where it was discovered. But in terms of the realistic ability of peptides to get through the stomach and into the bloodstream, we're not there for most things.
Okay. And let's go back to the safety for a second, because you were
Yeah.
mentioning most of them are not FDA approved. So, can we be confident that they are safe? I mean, we're also hearing that there's like black markets for peptides
Yes.
but let's assume someone went through a medical doctor like you. How can we be 100% sure that what we're getting is what we think we're getting and that there aren't any contaminants in it and it's the
Hmm.
right amount? All the things that we would typically rely on the FDA approval for.
Right. That's a great question. And I think this is an area where it is important for people to know that there has not been as extensive of studies as most of the drugs. Because of how peptides work, they tend to be a lot safer because they don't rely on the liver or the kidneys, because they don't force any pathways on and off, because they mimic something that the body's already naturally doing. We just haven't seen many side effects or major adverse effects from peptides. But the quality of the peptides is really important. So we work with FDA registered labs that create peptides that we then send for independent testing to another lab that has no affiliation and that checks for something called endotoxicity to make sure that there's nothing toxic in the peptide in the process of making it, for sterility so that there's no bugs or bacteria or anything in there that shouldn't be in there, and then for purity, and if it's not 99% pure or above, then it can't be used. And for most compounding pharmacies, the cutoff is 97%. We use 99%. So they have to be independently tested. And we've found that once we do that, we do have a really good track record of safety. But I think that people do have to make their own decisions in the sense of this isn't 100% without risk. There are things that we don't know, and I always want to be upfront with people about that. There are some peptides that do have FDA approval. So we know that the GLP-1s have gone through the process of FDA approval. And there's two growth hormone promoting peptides that have also been FDA approved for various indications. Tesamorelin is FDA approved as a Grifta for what's called visceral adiposity. So basically too much fat around your belly specifically for HIV patients. So that's been studied very extensively in a high risk group of patients, and it has very good safety data. Samorelin is another one that got FDA approval. And then there are a few that are approved in other countries, but not in the US. So there are a few that have gone through rigorous study and others that haven't. And when I work with patients, I usually I want to make sure that people know that. I think that's the most important thing. You should be working with someone who understands the safety data, what's available, what's not. Something like BPC that has not gone through FDA approval or approval by another board like that in another country, but it's been used for a very long time. And we probably have the most clinical experience with it. And in terms of reported adverse events, we just aren't seeing any. There's a lot of animal studies. Usually when new compounds are studied, we look for something called an LD50, which is the lethal dose. So they give it to something like a mouse and see how much you would have to give in order for that to happen. And with BPC, they ran out of BPC before anything bad happened to the mice. So there's a range of evidence that we have for different things. There are contraindications. I usually talk with people for quite a while and understand their medical history, their family history, and anything else. I think it's always a risk-benefit analysis. But having said all that, I think that these have some very potent anti-aging properties, and they can really be fundamental in preventing chronic illness. We know that chronic illness happens because of inflammation. All the things we talked about with skin. It's also inflammation. It's damage from carrying too much fat, having high blood sugar, mitochondrial dysfunction. And when peptides address the root cause of some of these things, we see people not get heart attacks and not get high blood pressure, not get diabetes. And those are the outcomes that we're looking for.
Is that true even about the peptides we were talking about for skin and hair, since they're targeting inflammation?
Yes.
Wow.
I think they are. Yeah. I mean, I think that there are a number of peptides that are being studied for longevity, and your immune system is also a key actor in how we age. And as we get older, something happens that's called immune senescence, which means that basically the immune system gets old. And when we're young, the immune system is constantly searching out cancer cells and getting rid of them. We're always making them. But the older we get, the less efficient the immune system is at that. So something like thymosin alpha-1 is a really promising anti-aging peptide because it tunes up the immune system to fight those bad guys, to find the cancer cells and kick them out and get rid of them before somebody actually gets cancer. So there are a number of things like that really work at the root level of what we understand as aging and chronic illness.
It's fascinating. And it's so interesting that you, as the doctor, could be approached by a patient who's complaining about aesthetic issues and potentially given a peptide that's actually helping her fight off cancer cells and live longer and look better in the process.
Yeah, that is a
I'd
cool
say
thing.
it's time for some good news for midlife women. So this might be it.
Yeah, it's awesome.
Dr. Gajer, thank you so much for coming on and sharing so much wisdom with us. I know listeners are thinking, where is this doctor located and can I work with her if I'm not in her state?
Yes. So we are in Northern Virginia, right outside of Washington, D.C., and we can work with clients on peptides and in a health coaching capacity throughout the United States. So you can find us on our website. It's thegajerpractice.com, or on Instagram. There's a button there to book a free introductory call, and then we can have a conversation with you and tell you how everything works and if it'll be worth it for you. But yes, there are some limitations in other states where I can't always order labs, and there are sometimes some restrictions, but in terms of peptide therapy and guidance, we can work with people in all 50 states, actually all over the world.
Amazing. Okay. I will link to your website and Instagram in the show notes. You can go find her there. Thank you so much. This has been very enlightening and very informative.
Thank you. Yeah, great talk.
Quick reminder, I am not a medical provider. This episode is for education and general information and is not medical advice. Please talk with your healthcare provider before making changes to medications, supplements, or beginning any treatment. And as always, guests are here to share their own expertise and perspective. It doesn't necessarily mean we agree on every detail.